Let's talk about something powerful. What if I told you the most powerful thing you can do to protect yourself from cancer after 50 isn't tied to expensive treatments, complex medications, or any of the things your doctor has probably already suggested? What if it's something so simple, yet so many people overlook it entirely? And what if this science has been quietly backed by research for years, with only a handful of oncologists truly aware of its significance? Stick with me for the next few minutes because I'm about to show you something that could completely change how you think about your health, potentially for the rest of your life. Having worked in oncology for over 2 decades, I've sat across from countless patients, delivered heartbreaking diagnoses, and on numerous occasions asked myself the same question: what could we have done differently earlier? And time again, as I reviewed the data, I kept coming back to one area that simply didn't get enough attention in conventional health conversations. I'm talking about chronic inflammation and how profoundly it contributes to cancer development after the age of 50. Now, before you start tuning out at the mention of inflammation, stay with me. What I'm about to explain will reshape everything you think you know about this term. When most people hear the word inflammation, they immediately think of something like a swollen ankle or a sore throat, something that's painful, obvious, and temporary. And in that case, you're right. Acute inflammation is actually something your body uses to protect itself. It's a normal, healthy response. You cut your skin, and your body floods the area with immune cells to fight off bacteria, repair the tissue, and heal the wound. This is your immune system working beautifully to keep you safe. But here's the kicker. There's a second type of inflammation that is far more dangerous. It doesn't show up in the form of visible swelling or pain. Instead, it quietly lingers inside your body year after year, like a slow-burning fire you can't see or feel. This is what we call chronic low-grade inflammation. And it's this persistent inflammation that we're learning is one of the primary drivers of cancer initiation and progression, especially after age 50. Let me share some numbers with you. A groundbreaking study published in Nature Reviews Cancer found that chronic inflammation is a contributing factor in about 25% of all cancers worldwide. Another major study that tracked over 100,000 adults found that those with elevated levels of C-reactive protein, CRP, a marker of inflammation, had significantly higher rates of colorectal, lung, and breast cancers over a 15-year follow-up period. Now, when you consider that 1 in 2 men and 1 in 3 women will develop cancer at some point in their lives, these numbers become staggering. So why does this happen? How does inflammation create the perfect environment for cancer to thrive? Let me break it down. Every day, your cells are constantly dividing millions of times. Most of the time, this process goes smoothly. But when chronic inflammation is present, it creates a condition called oxidative stress. This means your cells are exposed to free radicals, chemically reactive molecules that can damage your DNA as it replicates. When this damage occurs and the body doesn't catch it in time, it can result in mutations. Over time, these mutations accumulate and can lead to the uncontrolled cell growth we call cancer. But that's not all. Chronic inflammation also has another, even more insidious effect. It suppresses the function of natural killer cells, your body's internal security system. These are the immune cells responsible for identifying abnormal or precancerous cells and eliminating them before they can grow into something dangerous. When inflammation is chronically elevated, these cells are less effective, they become slower, and their ability to catch potential cancer cells weakens. This opens the door for cancer to slip through and establish itself in your body. Here's the shocking part. After the age of 50, your body naturally shifts into a more pro-inflammatory state. This process has even been given a name, inflammaging, which combines inflammation and aging. As we age, our immune system becomes less efficient at controlling inflammation. It starts producing more inflammatory signaling molecules and becomes slower at resolving inflammation. This makes everything more challenging. The lifestyle choices we make, our diet, sleep, stress levels, start having an increasingly significant impact. You might have gotten away with certain habits in your younger years, but after 50, those same habits can compound and cause much bigger problems. So what can you do about this? What is the simple yet powerful method that can help reduce chronic inflammation and lower your cancer risk? Let me explain. The good news is you don't need expensive treatments or complex medications. There's something you can do right now, starting today. The most evidence-backed strategy I share with my patients involves 2 key things: a Mediterranean-style anti-inflammatory diet and one very specific habit that most people either do wrong or aren't doing at all. Let's talk about the dietary piece first, because the research here is overwhelming. A massive study called the EPIC study, which tracked over 500,000 people across 10 countries for more than a decade, found something incredibly consistent. People who ate a diet rich in colorful vegetables, legumes, whole grains, olive oil, fish, and nuts had significantly lower rates of several cancers compared to those who ate a typical Western diet filled with processed foods, refined sugars, and red meat. We're talking about dramatic reductions in cancer risk, up to 30% to 40% lower in some cancer categories. So, what makes this Mediterranean-style diet so effective against inflammation? The key lies in the food itself. Each of these food groups contains compounds that target inflammation at a molecular level. Take extra virgin olive oil, for example. It contains a compound called oleocanthal, which works similarly to ibuprofen by inhibiting the same inflammatory enzymes. But instead of taking a pill, you're drizzling it on your salad every day. Leafy greens like spinach, arugula, and kale are packed with folate and antioxidants, which protect your DNA during cell division. Fatty fish, such as salmon and sardines, are high in omega-3 fatty acids, which lower the levels of inflammatory markers in your blood. And then there are berries, blueberries, strawberries, raspberries, which contain powerful polyphenols like anthocyanins and resveratrol. These compounds have been studied for their anti-cancer properties, with resveratrol specifically shown to interfere with multiple stages of cancer development. This is not just fringe research. These are peer-reviewed, scientifically validated findings published in respected medical journals. The health benefits of this diet are crystal clear. But here's where most people go wrong. They think that eating healthy is enough. The reality is, diet alone is only part of the equation. The other equally important piece is consistent, moderate physical activity. Now, I know what you might be thinking. I already know I should exercise more. But hear me out, because this is where the magic happens. You don't need to run marathons or spend hours at the gym. What I'm talking about is 30 to 45 minutes of moderate movement every day. This could be a brisk walk, a swim, or a bike ride, anything that gets your body moving. Here's why it's so important. When you engage in moderate exercise, your muscles release compounds called myokines. These are proteins that have powerful anti-inflammatory effects throughout your body. Exercise also lowers your levels of insulin and insulin-like growth factors, which, when elevated, can contribute to cancer cell growth. In fact, the American Cancer Society states that physical inactivity is one of the most significant modifiable risk factors for cancer, second only to smoking and obesity. Now, I'm sure by now you're seeing a clear pattern emerge. Diet and exercise are two fundamental pillars when it comes to controlling chronic inflammation and reducing your cancer risk. But there's one more piece of the puzzle that many people overlook, and that's sleep. Specifically, the quality and duration of your sleep after the age of 50. Let me explain why sleep is so crucial. While you sleep, your body is doing the essential repair work that it can't do during waking hours. Your DNA repair enzymes are most active during deep sleep. Your immune system works overtime to consolidate its defenses, making sure it's ready to fight off anything that threatens your health. Sleep also activates a system called the glymphatic system, which clears out metabolic waste products that accumulate in the brain. This process is vital for maintaining overall health, including the health of your cells and immune system. The problem is, as we age, sleep often becomes more elusive. Many people, especially after 50, struggle with sleep quality and sleep duration. Chronic sleep deprivation, defined as consistently getting less than 6 hours of sleep a night, has been linked to significantly higher inflammatory markers in the body. Research has shown that poor sleep not only increases inflammation, but also weakens your immune system's ability to detect and destroy precancerous cells. In fact, a study published in the Journal of the National Cancer Institute found a direct association between shortened sleep duration and an increased risk of colorectal and breast cancer. When you don't get enough sleep, your body is essentially deprived of the time it needs to repair and regenerate. You're also more likely to experience higher levels of stress, which further amplifies inflammation. The takeaway here is clear. 6 to 8 hours of quality sleep is not a luxury. It's a critical part of cancer prevention. Now that we've covered the importance of diet, exercise, and sleep, I want to emphasize a critical point that most people miss. What you're doing with these habits is more than just improving your general health or losing weight. You are actively fighting inflammation at a molecular level. You're reducing the internal environment that allows cancer to develop and thrive. It's not just about feeling better or looking better, it's about creating a body that is actively working against the factors that promote disease. When you realize that your lifestyle choices can directly influence the biological environment inside your body, it changes everything. It's no longer just about checking boxes for good health. It's about making intentional choices every day to lower the risk of developing life-threatening diseases like cancer. But here's the thing, none of this requires a prescription. You don't need expensive treatments or supplements. You just need to understand your body and give it what it truly needs to thrive at this stage of life. When you shift your focus to reducing inflammation and strengthening your immune system, you unlock a new level of control over your health. I've seen incredible transformations in my patients, especially those in their 60s and 70s, after they made these simple yet powerful changes. When they adopted an anti-inflammatory diet, committed to regular exercise, and prioritized sleep, their inflammatory markers dropped significantly in as little as 3 months. Many of them came into my office convinced that cancer was inevitable, particularly because of their family history. Yet after understanding the science behind inflammation and its role in cancer, they left with a completely new perspective on their health. This isn't just about genetics. While your genes play a role in your overall health, they are not your destiny. Your environment, both external and internal, has a far greater influence on your health than most people realize. And the best part, you have more control over that internal environment than you might think. What you eat, how much you move, and how well you sleep all affect the levels of chronic inflammation inside your body. By making these lifestyle changes, you can essentially reprogram your body to be less susceptible to cancer and other diseases. And the impact is not just about preventing cancer, it's about reducing your risk for a wide range of age-related health issues, from heart disease to neurodegenerative conditions. If you're skeptical about how much power you really have, consider this. Many studies have shown that lifestyle interventions can lower the risk of cancer by as much as 30% to 40%. That's a huge difference. And that's not a distant possibility. It's something you can start working on today, no matter where you are in life. The small changes you make now can have a profound impact on your health as you get older. And it's important to understand that these changes aren't difficult to implement. It doesn't take a radical overhaul of your life. It's about consistency, small steps taken every day that add up over time. The goal isn't perfection, it's progress. Start by adding more vegetables, more healthy fats like olive oil, and more movement to your day. Aim for quality sleep and be patient with the process. As you continue to make these changes, it's important to realize that you're not just working against cancer. You're giving your body the tools it needs to protect itself from a variety of health risks. By reducing chronic inflammation, you lower your risk for conditions such as diabetes, heart disease, and even cognitive decline. All of these diseases have been linked to persistent low-grade inflammation, and by addressing it now, you're taking proactive steps to safeguard your health. However, as you incorporate these healthy habits into your life, it's also crucial to recognize the importance of consistency. One of the most common mistakes people make is thinking that these lifestyle changes are temporary solutions or quick fixes. The truth is, the benefits only last if you make these habits a permanent part of your daily routine. It's not about doing something for a few weeks and expecting immediate results. This is a long-term commitment to your health, and the rewards will come with time. That being said, it's essential to stay motivated. Understanding the science behind your actions will help keep you on track. When you realize that the simple choices you make every day, what you eat, how you move, and how you rest, are directly contributing to a healthier, more resilient body, it becomes easier to stick with it. You're not just hoping for the best, you're actively shaping your future health outcomes. Additionally, you don't have to do this alone. Find a support system that encourages your efforts. Whether it's a friend, family member, or even an online community, having people around you who share similar health goals can make a big difference in staying consistent and motivated. This is a journey, and like any journey, it's always easier when you have someone by your side. If you haven't yet, start by making small, manageable changes. Don't overwhelm yourself with the idea of having to overhaul your entire lifestyle overnight. Begin with one change, a more balanced diet, a daily walk, or prioritizing your sleep, and build from there. Every step counts, and the cumulative impact over time will be significant. As you continue on this journey toward better health, it's important to keep one final thought in mind. Taking control of your health is empowering. When you understand that your lifestyle choices, what you eat, how you move, and how well you rest play such a significant role in cancer prevention, you gain a sense of control over your own well-being. The narrative around aging and disease often focuses on things outside of our control, like genetics, but what we've discussed today shows that you have the ability to change the trajectory of your health regardless of your age or family history. The great news is that making these changes doesn't require extraordinary effort or drastic measures. It's about small, consistent actions that, when combined, create a powerful protective shield for your body. Reducing chronic inflammation through diet, exercise, and sleep is not only a tool for cancer prevention, but it enhances your overall quality of life. It's about thriving, not just surviving. Now, I encourage you to take the next step. Start implementing these simple, research-backed habits into your daily routine. If you're unsure where to start, focus on one area first, like improving your diet or adding more movement into your day. Consistency is key. Over time, you'll begin to see the benefits, both in how you feel and in your long-term health. If you found this information valuable, do me a favor and hit the like button below. It really helps the channel reach more people who need to hear this message. If you haven't already, subscribe for more evidence-based health tips and cancer prevention strategies. And don't forget to share this video with anyone you know who could benefit. We all have the power to make healthier choices, and together we can create a future where cancer is less likely to take hold. Thanks for watching, and I'll see you in the next video. Stay healthy, stay empowered.